Welcome to day two here at the ACSA Superintendents Symposium alongside Naj Ali Khan. I'm Michael Kelly.
Hey, good to have all of you here on this second day of the 2021 ACSA Superintendent Symposium. We had such a great day yesterday, Michael. I was thinking back to the Heather McGee presentation that we had, that student panel, and all of the workshops that were going on. And I know here at ACSA, we like to set a bar and then we like to get above that for the next day. And so here we are, day two. We've got more great content for you today. Pedro Noguera, our keynote speaker, will come on in our 1 o'clock hour. And then at 4:10 today, the happy hour edition of the ACSA Legislative Lunch Break, Edgar and I will welcome State Superintendent of Public Instruction, Tony Thurmond, on the show to take some questions and provide some answers from our viewers today.
But first, what we've all been waiting for, an opportunity to speak with the highest elected official in the state of California, and that would be Governor Gavin Newsom. And the man leading that interview, none other than ACSA Executive Director Wes Smith. He joins us now here on the main stage. Wes, we're looking forward to this.
Yeah, absolutely. Grateful that the governor could make time for us. Good morning, superintendents. Speaking of gratitude, I also want to thank the governor for prioritizing public education. We know that last spring, one of the first executive orders guaranteed funding. It protected jobs. It addressed food insecurity for our students, child care. He's been banging the drum for in-person instruction, focusing on equity throughout, has expanded our ability to procure PPEs. He and the first partner have helped narrow significantly the digital divide, and his team. His team has been communicative. The lines have been open. And even when we might not want to hear things, they let us know that it's coming down the pipe. So again, Governor, grateful that you're here and grateful for your prioritization of public education.
I appreciate it, Wes. Honor to be with you. Thanks for the opportunity.
Yeah, thank you. Well, let's dive right in, Governor. Let's start with the timing of your push for reopening. ACSA members support the push to get to in-person instruction as soon as it's safe to do so. Some folks are wondering why now, as they look at post-holiday spikes and some new virus variants. That being said, we understand the data are changing. Can you talk to us about your rationale and intent for the reopening push?
Well, if we wait for the perfect, we might as well just pack it up and just be honest with folks that we're not going to open for in-person instruction this school year. The reality, though, and I appreciate you, Wes, teeing up that data, it's moving in the right direction. And let me just underscore that, because I think people need to contextualize where we were, just as an example, when we reached peak number of cases earlier this month. January 4th, we reached over 60,000 cases of COVID positive. That record was rather jaw-dropping. It was an experience that didn't surprise most folks, because in November and December, we started to see those numbers come back up. We were experiencing, anticipating a post-holiday spike. But the numbers we just published today, it's a little over 16,000. 60,000 on January 4th, a little over 16,000 today. On January 7th, we had the highest positivity rate at 14.3%. Today, our 7-day positivity is down to 7.5%, almost in half. Hospitalizations down 22% in the last 2 weeks. ICUs down 12% in the last 2 weeks. Just as an example, because I know everybody top of mind, the issue around vaccinations, put it in perspective. On January 4th, the day we had peak number of cases, we had administered 43,000 doses of the vaccine. Today, I woke up, first thing I look at, data as it relates to positivity, case rates, and vaccination rates, 143,000 doses. 43,000 earlier this month, 143. So those are multiples, more than tripling of the vaccinations, with the prioritization of every one of you watching. We didn't take schools, we didn't take teachers, all the support staff, we didn't take you out. We kept you in that tier, one of a few employment classes that are in a tier. We obviously want to go to an age cohort, because remember, 75% of the deaths associated with COVID, 75% are people 65 and over, but we are prioritizing our schools in this effort and prioritizing them in this first tier. So look, everything that should be up is up. Everything should be down is down. We have an enormous amount of work to do. Your experience is different than my experience, different than the person to the left or right of you, because none of us live in the aggregate. What I gave you were the aggregate numbers in this state. That variable is self-evident in a state that's larger than 21 states combined. But I appreciate the frame of your introduction. My goal, and forgive me, it's born of an understanding that perhaps is a little different as a father of 4 very young kids. Not just young kids, a 4-year-old who's not learning online, just not. I mean, he talks about Zoom school. It's not working for him. It's not working for his parents. I'm trying to get him off the devices. And here I am, and he's just not paying attention. He's not learning. And I think that cohort, TK, K, 1, 2, they're struggling. People, I had severe learning disability growing up. Trust me. In this environment with my disability back when I was growing up, where I was already a couple grades behind and actually had high kindergarten slip back, those folks, they're not thriving in this environment, despite all the heroic work each and every one of you have done, heroic work. And let me just stipulate, thank you for everything you guys have done under extraordinary and challenging circumstances. You're the tip of the spear of anger, angst, stress, frustration. You have your own challenges as individuals and people that are raising kids yourselves and spouses and your own economic future and the anxiety and yet you're still doing incredible work, taking care of millions and millions of Californians that are getting educated, but not to the degree that we'd like to see, because we do believe for social, emotional, and other reasons that the ideal is in person. And so starting with that younger cohort, testing the theory that we can do this safely and judiciously, and in the process, build public trust, looking at small cohorts, building on wins, sharing best practices, holding all of us to account, more enforcement, more transparency, more support, but moving together to try to standardize expectation is just something we thought was the right thing to do in December. We didn't just wake up to this a couple days before February 1st. We announced this framework last month in anticipation we'd be where we are today, and an expectation, and this is important for everyone to hear, that we have to negotiate. None of us are ideological. I'm not naive about the stress, around these dates, but we had to plant the proverbial flag. We had to sort of establish a framework and say, all right, let's come together, try to negotiate off at least a set of expectations, work on all the nuances, create a framework of flexibility, because one size I get doesn't fit all. Try to address those that are already open and the challenges they're having with test cadences. Those that want to negotiate reopening, what do they need? What are their supports? We put out money, $6.6 billion, not $6.6 billion of early action. I put out a budget with record K through 12 funding, $89 billion that will be invested this year. And by the way, expectation with Joe Biden coming in that more money will be made available, partnerships that we're establishing with our own state testing lab. No other state in the country has a lab like we have that allows upwards of 150,000+ tests every single day at a third of the market rate to help folks create some more continuity. Pooled testing strategies, take-home tests, drop-off boxes. Many of you that are watching, you're already participating in some of the pilots with Valencia Lab. Thank you. PPE contract we negotiated. We provided 2 months for everybody, but we negotiated a master contract, so we're all getting the best pricing across the board. We're trying to be flexible, and we're trying to, I think, accelerate a conversation. And that was a long answer to your question, but it goes back to that question. We wanted to accelerate the conversation, because if we wait to get to the perfect, school year's over. And that wouldn't be doing justice to our English learners and our foster kids and our homeless kids and those very young kids that just are not experiencing the idealism that we would like to see of distance learning.
Now, Governor, thanks for that. Thank you, too, for mentioning your students and the difficulty with online learning. Folks are doing a great job all around the state. It's not easy. My son right now is in a dance class. So I've asked him while I'm talking to you to not do tap. So I get it. I also want to thank you for bringing up vaccines. I want to get to that in a minute, but let's stay on the topic of the early action, the $2 billion budget proposal in particular. While our members, as I said, appreciate the intent and there are aspects of it they really like, they've expressed serious concerns about the testing cadence. They wouldn't be able to afford it or implement it, that expanding collective bargaining will slow down reopening, and even worse, could cause schools who have already opened to close. And then the aggressive timeline may be impossible for them to meet. And so how amenable is the administration to making changes to some of the components of this budget proposal?
Completely. I mean, come on, I've been doing this 20 plus years, guys. This is about putting on a plan. It's about being iterative. It's not about being ideological. It's being open argument, interested in evidence. So ideology exists on all sides on this. People, if there's an old thing my mom taught me, says, you find whatever you look for. So if we want to find reasons not to open, we'll find plenty of reasons. If we want to start building on ways to strategize, to find ways of getting to where we all want to go, we'll figure that out as well. So I'm of the mindset, that's my focus, that we can work through these issues, recognizing the complexity, the nuances, the challenges each and every one of you face in a state, again, that's larger than 21 state populations combined. Nothing else like this anywhere in the United States. And so those challenges are distinctive, but that's why we brought in Dr. Bardock. That's why we brought in a strike team. It's why we brought this cross-dimensional frame of getting OSHPD, not just OSHA, to work with the Department of Public Health. That's why we put up a hub. That's why we put up a record amount of money. And again, it's not just $2 billion, guys. The immediate action's $2 billion, but the early action is $6.6 billion. And I really want to focus on that 6.6 because that's what we're really after. And it appears, and we'll see, working with the legislature, they may have deeper appetite to move all those dollars forward, which is tremendous from my perspective. Flexibility, of course, on dates, but not as a way of not doing anything, but as a way to being honest with each other about what can be done. And yes, as I noted a moment ago, and I'll reinforce, and I appreciate the nuance, you have schools that have opened and they're doing it safely. And I want to be very cognizant of the testing cadence in that respect and flexible to what's already working and recognize that through the collective bargaining MOU process and the rules that are well established in the state of respect and responsibility as employees and employers to collaborate and recognize that we can't do things to people, but we have to do things with people in that spirit to create a framework where we're building something for the long run and for success, because no one wants fits and starts. No one wants to see this happen and then everything get pulled back. But I'm confident we can do this safely. And again, it has to be done safely. No one is naive about that. I don't want to put anyone at risk. Are you kidding? Quite the contrary. And I recognize the stress that so many of you are under in your own unique status and conditions, and the pressure, again, that's mounting on everybody. But I can assure you the pressure we're getting today is going to pale compared to where it'll be in a few weeks if these numbers continue and other districts across the country start moving in the direction that the new administration wants them to move in. Remember, Biden administration put out a plan. They set the marker of expectation. CDC put out guidelines, very notably, in the last day or two. And so I just think all of us have to be cognizant of that as we are cognizant of one another and all of the unique challenges you have. Flexibility, absolutely. Working in the collaborative spirit, addressing your needs, of course, building collaborative spirit.
Yeah, that's encouraging. It didn't expect otherwise. But glad to hear that the negotiations continue, that we continue to work on the nuances of this, because as I said at the onset, our members believe in doing it as long as it's safe to do so. Let's get back to vaccines. And, it's not lost on any of us, that data point that you've shared. You've been able to share that throughout this pandemic. And we understand that most of the folks who are succumbing to this virus are over 65. And we've heard that, vaccines aren't a condition for reopening. We also hear from a lot of educators and educational groups that it really needs to be our focus moving forward for this year, and certainly for next year. I was listening to a 6-hour board meeting this week, and the head of the teachers union said to the school board, "If you'll vaccinate my entire team, we'll open every classroom." A student got up and said, "If you'll vaccinate every teacher, I'll feel safer coming to school." And then I heard Dr. John Garcia yesterday, one of our superintendents who works in Los Angeles County, one of the hardest hit places in the entire world, right? He said, "If we can vaccinate my team, I can salvage this year with in-person instruction, even in Los Angeles County." And so we know that it's important. But we know that there are a lot of elements here, federal government giving, California the vaccines, et cetera. But can you give us an update on what is being done to expedite the distribution of the vaccine, prioritize educators in all counties? When we say prioritize, we appreciate that you've put us in 1B. In some counties, we fall at the bottom of 1B. And so there's variation around the state. And then address any inequalities you see that concern you.
Yeah, look, and those inequalities include some counties prioritizing farm workers, for example, which is a noble cause as well. It's the challenge of the scarcity that we're in, not a framework of abundance. Look, let me just be as candid as I possibly can, and forgive me, and I appreciate you Wes saying sometimes you don't like listening to me because you don't want to hear what I'm saying, but this is my humble opinion, and it's based upon evidence and some facts that have been presented and are in evidence. You saw just today, Johnson & Johnson in the single dose, expect 100 million in the United States in June. In June. You heard the President of the United States put out, to his credit, a very transparent national vaccination plan that showed with the next 3 weeks, states like California receive 16% more vaccines over the next 3 weeks than we've been receiving. You start doing the math in terms of getting everybody vaccinated based upon what we know today. Again, it could radically change in the next few months. If everybody has to be vaccinated, we might as well just tell people the truth. There will be no in-person instruction in the state of California. Just tell them the truth. I mean, I can't, don't mislead people based upon the facts you know today that are in evidence. Now, again, they could radically change, but after Johnson & Johnson came out, that was what I was really hoping we can pull forward, that June date, but they're saying June. Again, maybe it's May, April, I don't know, but it's still getting late in the school year. And so if vaccinations is the absolute, then, maybe we should be having a different conversation with people of the state of California and parents, including myself, my wife, many others. And so I think we can reopen schools safely without every single person in the state of California being vaccinated. I just believe that. I know that's flippant because we're not talking about every single person in the state of California. I hear you. You get the spirit, the gist of what I'm saying. We have committed. We are advancing that commitment. I was talking to Mayor Garcia down in Long Beach. They're starting to vaccinate teachers. I was like, thank you. He's, by the way, he's doing a beautiful job down there in Long Beach, across the spectrum, but he's using the tiers. He's prioritizing the most important people, our teachers and our staff, all of you, as a priority. We're prioritizing food and our food workers, which we just think is so important. And they were heroes as well in this pandemic. And we're prioritizing our first responders. But that's the only employment-based criteria we have out. And then it's age cohorts after that. So you're in that top tier. That's our focus. And every single dose we get, we're trying to get out faster. I told you we've more than tripled our daily vaccination numbers. You're seeing now closer to 60% of these vaccines have been administered. And we've got this 2-3 day data lag, which is killing us in terms of some of the national numbers. But we know our internal numbers suggest a lot more vaccinations that are being publicized. And we're going to do everything in our power to get as many of our teachers and many of our principals, cafeteria workers, our bus drivers, our janitors, those incredible people that got into this profession to be with the kids that want to go back to work, and all of you that are part of that ecosystem to make our schools work. It's top priority.
No, thank you. And again, we don't even understand the complexity of it because we don't see the statewide perspective. That's one of the benefits that you and your team have, and other leaders at the state level. And we're certainly hoping to be able to help brainstorm how to do this. We understand not everybody can be vaccinated, as you said. Maybe those folks, though, that have been open, or those folks who have agreement to open. And, you mentioned classified leaders. I'm so glad you did, because one of the things that I would hope the entire state would add to the narrative is, as we look at vaccination and prioritize this profession, let's prioritize educators, not just certain groups. Classified folks have been on campus feeding students, cleaning rooms. And in some districts, the only folks that have been in person or on campus are site leaders or district central office staff. And we know that around the state. And so we're hoping we can lift up the inclusivity of all educators, and then work with counties and hopefully get some help from the state, working with counties to say, let's not forget that these educators are a priority, and especially those who are doing it already, and those who are ready with agreements to reopen. But thank you. We know that isn't an easy one at all.
No, and look, for us, it's and, not an or. And unfortunately, we're just in this framework where in the next number of months, based upon the new administration's own assessment, just the last 48 hours, that it's going to be some time to get where we all want to go. We had an internal goal, 4th of July, 280 to 300,000 doses every single day, get to about 70% of all Californians that were willing to take the vaccine. And it's just all subject to what happens with the federal allocation. They have the vaccines. By the way, just remind you guys, state doesn't receive any vaccinations. I get people calling all the time. Would you give me? I'm like, it's not like in the back office at the governor's office, all the vaccines, they're all sent directly from Pfizer to a provider network that includes over you think we have a lot of school districts. We have 5,000 providers in this state. 100,000 people that are eligible to administer the vaccines, but 5,000 folks, already about 3,600 that are now in our formal provider network that are active. And so we're trying to streamline all that. Goes to your question. We are streamlining, announced yesterday, a new third party to help us administer, partnering with the counties, but with more efficiency, more throughput, and maintaining our full-fledged commitment to equity. We're not backing away from it. And let me and forgive me for, again, belaboring this, but I want to give you a sense of what this tiering means, because it matters to all of you in terms of schools and vaccinations. We say, all right, we have flexibility because we want guidelines not to be barriers. So the flexibility is 65 and over, but again, common sense dictates you start 75 and over. It's kind of like boarding, forgive me. We've all been at the airport, all those fancy folks in first class. So all the first class, 75 and over. And then they announce, all right, everybody 65 and over, that's business class. Now, we don't wait for everybody first class to board before business class. Like, no one, all right, now we'll move you through business. And then it's premium class. And that's literally schools. That's all of you. And then we get to, general boarding, the rest of us down the line. And so we're trying to move this as quickly as possible and not make, forgive the Voltaire moment, but perfect the enemy of the good, by just getting through every single one and then having all these vaccines still in the freezer. And by the way, includes family members too, because I know a lot of you watching are wondering, all right, I got a vaccine, but I'm scared to death about my mom or my dad or my brother, my sister, my husband, aunt, uncle. So we talk about ecosystems within the school, classified, thank you for that, but also the ecosystem at home, which I know is very important to everybody, and how we could start to accommodate that and how we could create some flexibility in that space as well.
Yeah, thank you. And, looking at our time here, I had another question about testing, in particular testing of students. As we look at, the science that you've shared with us about the low transmission rates for many of our student groups, age groups anyway, and how might we better use the resources we have. But But I don't think we have time for that one. I want to give you a chance to do what we like to do at the end of each of our broadcasts here at ACSA. We convene people to clarify, to educate, to inspire, and to give hope. So we like to end with some hope offering, if you will. So it's as you look forward and you see the statewide picture, yeah, you see the data next week, next month, the next 3 months, next fall. What brings you hope?
Well, I think all of you, I mean, people aren't giving up. We're resilient. People are discovering their capacity. The layers and layers of capacity people never even knew they had. That resiliency is sort of demonstrable, isn't it, with the state budget surplus? And by the way, you ain't seen nothing yet. Wait till we announce next week's numbers, which should encourage all of you, because it'll provide resources is really not the issue in terms of addressing the testing needs or anything else. It's resourcefulness. It's a different mindset. It's a California mindset in so many respects, right? That entrepreneurial energy, that innovative energy, success leaves clues. So many of you, and thank you, have figured this out and are doing it, and you're keeping everybody safe. Some have tried and weren't as committed to safety, and we got to own up to our own enforcement in that space too. We got to help you. We also have to all be held to account. But that resourceful mindset, fundamentally, Wes, is what enlivens me, because that's more abundant now than ever. Our capacity to think and act anew. I mean, we didn't know we had this capacity. We're a year into this. The first case of COVID came on January 26th, a couple down in LA and one in, I think, Orange County or San Diego. And here we are a year later, and we're still at this. You guys haven't given up. You care about these kids. You care about figuring all this out. We're all trying to work together here. And, I appreciate, some shots, that's what I get every day. And I read those, they get to me. I appreciate not all of you are happy. What the hell is plan? And geez, I get all that. Hey, come on. Because I get the stress you're under. And, but I appreciate, Wes, you making this point. I mean, it's many parts, but one body. That's what Father Cause taught me. Right? The Bible teaches us we're many parts, but one body. And so I think of the California school system and its relationship to each other and district relationships to each other. And, I've got to consider that, but also I recognize many parts. And so we're trying to nuance that. You got Brooks, who's just, I think, done an amazing job. Linda, who's like, I mean, how lucky are we? Linda's like the right hand of the Biden administration, all of it. In terms of the partnerships, you want optimism, 3 words: President Joe Biden. And the incredible work Ben is doing with Anna and Wes, you, and the spirit of your willingness, even if you disagree, without being disagreeable, not taking cheap shots, not trying to undermine us, trying to educate us. I care about this, as you said, just not only intellectual. Like, you can't get this economy moving again. You can't. We can't help mothers. My wife reminds me every single day. This is devastating on moms, women in particular. Respectfully. I mean, it is, guys. More so. Not everybody, but more so. And so this is really, really important. And there are no do-overs with these young minds. And I worry about catching up, even with all the interventions later. We may lose the mental health issues. And so that's why we want flexibility in that $6.6 billion, equity always, but give you guys, think anew. Don't be in the box. What's a school year look like to you? It's not based on yesterday's calendar. What's tomorrow's calendar look like? What's a school day look like? What does your academic intervention look like today? What could it look like in a month to address learning loss with $6.6 billion? What can you do on mental health? Something we're just, our wellness, I'm desperate to do more when we get back to some feminist normalcy. What we can do for our special education system. You see, we keep putting more money in that space. It's, I hope people are paying attention. I care about that. What can I do? So let's reimagine. Let's take that creativity, that resiliency, incredible work that all of you are doing. Share those best practices, which is what your organization is really all about at the end of the day. And, and demand more and better from me and others, because you deserve that. And good enough never is. But know we're flexible. We're committed, not interested in your success and your professionalism. We have always in mind. And so I close by just saying this: deep respect, candidly reverence. Literally, I'm sitting here because of folks like yourselves. I mean, what a privilege. Doesn't feel like it last year, being a punching bag, but what a privilege. And that happened because of all of you giving a damn about strangers like me when I was growing up. So thank you for the minds you're molding, the opportunities that you're presenting every single day, the incredible work you have done with distance learning, and those of you that have stubbornly advanced in-person learning. And let's work our tails off in the next days, not months, next days and weeks. And let's land somewhere where we can all, go together, but go far, not just fast, but go far, respecting collective. We got to respect one another in that collaborative spirit, but we also have to be stubborn in terms of our advancing our goals as well. I've belabored my response and your time, but Wes, I'm just grateful to everything you guys are doing, and thanks for the privilege of this opportunity.
No, thank you. And I chuckled. I don't know if you saw it when you mentioned the shot. I thought we might get through the interview without the mention of the letter, but glad that you brought it up. Look, our members want to help land the plane. And we're convinced that if we can address a small number of things, we can land this plane. And so I'll tell you what gives me hope is hearing you say today that you're willing to engage those things. And you said it forcefully. So let's do it. Let's land the plane. Let's innovate. Let's be better next year, because our 6.3 million students deserve no less. So, Governor Newsom, thank you for making time for us. Thanks for being here, and thanks for your candor and honesty.
Thank you, guys. Appreciate you all. Thanks so much.
All right. As we shared in the chat, we're going to do a Q&A. The governor's team have been generous enough to stay on. And so for the next half hour or so, they're going to answer questions from all of you. So an interactive fireside chat. We know that's what you wanted. Grateful for Brooks, Ben, and Dr. Bardak. She was hanging out with me this week on one of my shows. So it's almost like we're family now. In any event, I'm going to pass it over to Edgar and Naj to do the Q&A and thank the governor's team for staying on and providing this.
I think Naj may have been having some issues there with the audio, so I'll kick it off. Well, that was great. Obviously, getting the governor to just share some of that vision. I think we're really grateful to him and his team. And what we thought that we do, we know obviously the governor of California, time is limited, but his staff, as Wes mentioned, graciously offered to stick around and dig in on some of these issues. And we know we're seeing the Q&A, we're seeing there's a lot of attention. So we'll use the next 30 minutes or so to try to do a little bit of follow-up there. So I think we're going to have Brooks, Dr. Bardak, and Ben come on in right now. There we go, like magic. We got you back, Naj. I was worried there for a second, but you're there, right?
When you're broadcasting out here from the sticks, as we've said many times, you never know when the signal is going to work. And what I was going to mention was this is actually Dr. Bardak's third appearance with us here at ACSA in the last 2 weeks. So at that point, Dr. Bardak, we just have to get you business cards. You've been here so often.
Yeah, I'll be clear. I got invited to one of them even before I got this lead of the Safe Schools for All team when I was still associate professor of pediatrics back at UCSF. So it was a funny sort of overlay of like, oh, here I am again, delegating. So happy to be here.
We knew big things were ahead for you there. That's how we put in the request early. I think I got the first question. So obviously we see a lot in the chat. So our team is going to try to decipher some of this, and again, thank you. I know it's almost like the principals came out. We might be the JV team, but we're gonna dig in here and try to have a good conversation. Saw a question in the chat from old friend Hilda Maldonado about, and I think we're gonna put that up. Essentially, she was asking, like, we've heard this, and you guys have heard this feedback that in a lot of schools, a lot of LEAs in the district, what's happening with this February 1st deadline? Is it still going to be in place? How are some of the new requirements? And I'm going to use quotations and requirements because I know you're going to explain that again in terms of the difference between the incentive grant and the CDPH. But on the CDPH, let me actually use this as an opportunity to ask that question. We've also heard some challenges in terms of folks that were open, especially those that might have been open, that had their mitigation efforts in place, and they see the CDPH guidance, and one of the examples, the 4 foot of distance, right? And they say, well, actually, we were doing something different, and we were doing it safe. Maybe if you could kind of touch on just the broader piece on the deadlines, but also what, if anything, are you thinking about? Is there going to be a mechanism for schools that have been able to show we've been doing this effectively? We may not be following these new guidelines to a T, but would there be any type of relief that they would be able to see? And I don't know who wants to kick it off. I'm sure all of you can contribute at that. I'll leave it up to you who wants to jump in first.
Maybe I'll frame it. I think there's two different parts to that question. One is the deadline question, and the other one is the guidance question. And is there some, are there specific parts of the guidance that people have questions about, and that might actually lead students go back to distance learning in a situation where a school or a public health department together feel like it's a safe environment. So I think the February 1st deadline, maybe I'll let Brooks or Ben speak to that a little bit more. But I will make one clarification, which is the February 1st deadline is, there's one piece of it, that February 1st date, it comes up in a couple of different places. So one very clear piece that is not going to change is just that for schools that are already open, that have been open, they're operating, they need to also put together what's called a COVID safety plan, and that's for an effort at the state level that is in response to a lot of stakeholders asking for clarity and consistency and transparency. And so even people who are already open, who have their plans in place, we're asking them to fill out the COVID safety plan, and that is asked to be posted by February 1st. COVID safety plan has two different elements to it. One is a checklist, and the other one is the Cal OSHA plan that schools already should have in place. And so the hope is that it's actually not a big burden for them to already have that plan because they've already put it together, because Cal OSHA regulations came out in early December, late November. So that's one thing about the February 1st thing. And then I'll just mention also, we have heard about that there are some very specific situations in which kids who are in school might go back to distance learning, or situations where people feel like they were about to do some in-person instruction that felt like it was safe, and that there's parts of the new guidance that sort of really stop people in their tracks in a way that the local health jurisdiction would feel comfortable would be a safe situation. And so we're working on a process. We've heard there's just some very specific situations, and we've heard that, and we're working on a process to try and figure out how to do it in a predictable and a transparent kind of way to work those things through. I will say that there are very specific situations using those criteria I just mentioned, and it is really important because if there's any sort of movement on that guidance, it means that we know that we have to see that there's evidence that it is safe to continue to operate in a way that somebody's been doing, and also that there's a comprehensive safety plan that's in place in all other aspects. So hopefully that's a little bit of a helpful frame, and a little bit of the story is there is a process that's happening right now, and we've heard that feedback.
So Dr. Bartik, just to follow up, just because I know this is like the question of the week, just so I kind of summarize it. So just so we're clear, the intent right now is that you folks are working on some mechanism for those instances where somebody says, hey, we've been open, and because of the guidelines, I may have to go back to distance learning. That's obviously not the intent of the administration. And what I'm hearing, there's going to be a mechanism to try to mitigate that, correct?
That is exactly right. And I would just add one piece to it, which is that if it's safe, right? So there is no intention for the administration or for me as a public health person to say kids should go back to distance learning as long as it's safe. We always have to have those two pieces. We know that in-person instruction is the right way forward, but we also know we have to do it safely. So just helping people to remember those are the twin goals.
Thank you.
Dr. Barta covered most of it, or all of it. I just want to add on a little bit more and just, I think to us, a lot of this latest effort that you've seen is, I think this was a question raised by a couple of you, an effort to consolidate a lot of the requirements that were out there. Dr. Bardock mentioned the CDPH guidance that was first issued in June of last year, and the Cal OSHA regulations that were promulgated at the end of November. And so part of the effort was the team just wanted to make sure that as much as possible, the different sets of requirements were consolidated so that it would be less burdensome for folks to be able to track what's required, what is critical, and to really be able to streamline that a little bit. I think second thought is just on sort of the what Dr. Bardock was saying about consistency and just making sure that settings are safe. We understand that, as the governor said, we don't live in the aggregate. It's hard to set guidelines that are going to work for all schools and every site throughout the state. And so what Dr. Bardock is talking about is, at the end of the day, for us, it's about safety. It's about ensuring that the right combination of precautions and mitigation layers are put into place. There's not really a one-size-fits-all solution. And so even though the guidance kind of outlines the key precautions that should really be focused and implemented, we also want to make sure that schools that have found ways to achieve safety without necessarily ticking every single bullet point are still able to, continue with in-person instruction. So that's the overall sort of rationale and thinking behind a lot of this.
Let me send this one over to Brooks and Ben. This comes in from Abby Slavensky, who is over in Amador County. She asked the question, I lead a district that's been open in a hybrid model since mid-November. Our greatest challenge has been staffing due to illnesses, vacancies, and subs who do not come into work. We put this in a lot of our smaller districts. In what ways can the state assist with this problem? So Brooks and Ben, I'll let you guys try and address that.
Yeah, I think just quick off the bat, we've heard this up and down the state, right? It's true in the rural areas, it's true in our urban areas. We know it's a deep challenge for everyone. And we are looking at all possible opportunities. I know there have been a number of things offered. It really, I think, most specifically, it's underscored why we thought it's so important to, when we looked at how we support schools that are open, and we look at encouraging those who are looking to reopen, taking a phased approach to it. It is really focusing on those earliest grades and on cohorts of the students most impacted by the pandemic. Because in that way, the hope is that can help address some of those staffing challenges. Well, obviously everyone's looking to figure out how you can get more staff available. But in terms of actually how many you can actually get into the classroom, thinking that phased in approach really will assist with that effort.
And I would just add to emphasize that, and for what the governor was talking about in terms of, having the spirit of collaboration, ensuring that we have people feeling trust and confidence in the safety of schools, that's part of all of this as well. I think there's, at the end of the day, we're hearing about the staffing shortages and substitute shortages. And, to us, that problem, there are going to be some solutions to it, but that problem, probably the main solution, is ensuring that there is an environment in which people feel safe to return. And that's really sort of one of the key animating principles that we're operating off of.
Dr. Bardock, I'll direct the next one to you, and others obviously can chime in here. I'll summarize a kind of a theme that we were seeing in the Q&A, and a theme that I know you've heard just in your you've done a great effort on trying to touch all stakeholders, and you've put yourselves out there. So we definitely appreciate that, even when some folks may not agree with every component. So it's testing, the testing cadence, and then the efficacy of asymptomatic testing, especially for the youngest students. And this is one of the questions Wes alluded to, they didn't get to. So obviously the guidelines talk about mitigation efforts and what could be more effective. We've seen that there's mixed perspectives from a lot of experts of the effectiveness of asymptomatic testing for the youngest students. So maybe if you could talk to us about that. And if that is the case in terms of the science, kind of the rationale on doubling down on that piece of it as it relates to the incentive grant. So I know I'm merging two issues there, but based on like what is the advice on asymptomatic testing, especially for young students, and then how does it connect to some of the requirements in your proposal?
Yeah. So the rationale around asymptomatic testing for kids, it's a couple different things that I think are helpful to think about. One of which is in our in the mitigation layers and those strategies that we have in place, we've maximized a lot of them. So the masking, physical distancing, ventilation, hand hygiene, symptom screening, and contact screening, and then testing in response to that. The piece that we haven't maximized either in the schools or as a society in general actually is the asymptomatic testing. And so it is a real emphasis that we're still working on this pandemic, and we still are not quite there, and we're not quite there for the schools in many situations. And so that's another place where we can put in some extra layers that help reassure people and understand what is going on the ground. So there's the asymptomatic testing is partly in order to catch infections, but it's also to inform us about what is actually happening. And that's true for students and for staff members. And the example that for me is compelling is the New York City example, which is they are doing student and staff testing, and they're getting rates of like less than 1% positivity, like very, very, very low. Even as their community rates are going up and down in their schools community, their random asymptomatic testing is showing them that things are okay, and it allows them to stay open as they go up and down, or to at least make informed policy decisions. And that's in contrast to Boston, which early on, like in the fall, when their community rates went up, they didn't have that testing and they just shut down their schools because they were anxious and they didn't know. So that's the general sort of framework. There's two other pieces there, one of which is that the Biden administration is signaling that actually they're moving quite aggressively towards doing a lot more testing, including in schools. And the Rockefeller Foundation, which is talking closely with the administration, has a report out saying weekly testing of students and teachers at all levels, all tiers. So for us in California, part of it is like we want to maximize this one other layer. If it can get us closer to an open economy fast, that's important. And then also in response to seeing what's coming down the pike. And I think I'll probably stop there. But I can also talk. So there's the decision making, and then there's the feasibility piece. And I can talk about the feasibility piece if that's helpful as well, about the student testing, because I know it feels overwhelming when and it's probably because the testing technology is changing a lot. So the good news is that there's actually better methods now that we have that we think could be helpful for people to do this.
And Dr. Bartik, on that note, since you referenced it, and there wasn't a question, but a lot of folks in the Q&A expressing their comments about how they feel about the requirement in terms of the feasibility, as you say, to actually achieve it, right? Even aside of the science, just given true challenges with capacity and of actually achieving those metrics. So yeah, if you folks want to touch on that, and if there's any willingness, obviously the governor said that there is willingness to rethink some of those components. So if you want to elaborate on that.
Mm-hmm. Maybe I'll talk about feasibility, and then Ben and Brooks can talk a little bit about the trailability, the funding piece of it, and how that connects with the testing. So there's two things about feasibility that the state lab is sort of supporting. One of which is actually on the staff side. We are not quite there yet, but working very hard, and I think very close to being able to say that staff are going to be able to get a kit and do their own collection rather than have somebody else do the collection. And that just alleviates a big burden of like staff having to go somewhere and get the test done, and then having another person involved with collecting the samples. So that's a really important and hopefully helpful thing that will actually alleviate the burden for a lot of schools who thus far have an idea in their brain, understandably, that they have to set up a big testing site. And I just heard from Superintendent Matthews in San Francisco yesterday. He's like, it was in the parking lot of 555 Franklin, and like, so I think that solution of people being able to do it on their own, it just simplifies everything and makes it easier for the teachers. That's one piece. The other piece is the student piece, which is that people also have an image of like the kid sitting there and there's an adult hanging, sitting over there and putting this long tube down, this long swab down their nose, and the kids that are like, oh, this sucks. The other way that you can do it, which we have some training resources available that are coming up soon, is actually have students do what's called supervised self-collection, where the adult hands them a swab, stands 6 feet away while the kid takes down their mask, and then they do it themselves in the front of the nose. Kids, we did a study over the summer that even in kids as young as kindergarten all the way through 8th grade are able to do that supervised self-collection quite effectively. And anybody who's hung out with a young kid knows that they're very comfortable putting things in their own nose. And that they're really good at it. Actually, if they hold that swab, they're much less anxious, and they were quite comfortable doing it. And then the last thing to say, you can do a group at a time. It doesn't have to be one kid at a time. So the feasibility issue gets a little bit better. And then I saw there's a chat also asking about pooled testing, which is also being able to take multiple swabs from multiple kids and see if they're all negative. You just have to do one test on that whole group of swabs. So that's also a technology that is Valencia is working on, and is almost I think they might actually already be up and running, or they're very close to it. So there's a whole new website that came out this week also that you can find on the school's hub that's about student testing to help provide those resources.
Ben, Brooks, anything you want to add on the other piece of that in terms of just movement on the larger proposal?
Yeah, Matt, I'll just say, I think to build on what the governor offered, we've heard the concerns, I say, in 3 large buckets, right? I mean, one specifically around grant application deadlines that obviously when they were announced, as the governor talked about, announced in December, we were talking about being aggressive because we wanted to try to make sure that folks were doing the planning necessary when conditions allowed for a safe return, or maintaining classrooms open. They would be able to do so. Look at the February timelines. Obviously, as we're getting near the end of January, that's looking like an area that we will have to be discussing in the ongoing conversations with the legislature. And the other 2 buckets are the practical challenges and concerns, some of which Dr. Bardock just responded to a little bit, around how to get to a place where you can meet those state-supported testing cadences, operationally, cost-wise, and otherwise, in terms, especially particularly with respect to students. And then, the third bucket, and I know Wes touched upon this in the earlier piece, is how to strike that right balance to getting labor buy-in, and how do we make sure that all the partners feel comfortable and safe about coming back in a place to provide in-person instruction, and how to ensure that's part of the total package that we're doing. So those are all 3 areas that we've heard and appreciate, both written and verbal, and a lot of our meetings around those 3 issues, and continue to be areas of discussion with the legislature.
Let me go ahead and ask a question to Ben and Brooks, and feel free, whichever one of you would like to jump in to start. This comes in from Krista Woodgrift, who's over at Sage Oak Charter School in Los Angeles. She asks, is there evidence showing spread, no spread at schools that have been open in person? And do we have data on these schools to help guide decisions? We know that the governor has relied heavily on data throughout this process to help make decisions and help guide strategy. Do we have any of that data to help guide some of the decisions?
So actually, I think Dr. Bardock is the best person to answer the balance of this question, but I'll just kind of tee up a couple of things, which is, there's the CPH team actually pulled together incredible documentation of the current science around in-school transmissions and how to create safe working and learning environments in schools. And so invite folks to take a look at it. And I'll just, put it, Dr. Bardock can't really say this for their own work, but I'll say it's really incredible work in terms of striking the right balance. It's not a sort of pitch document one way or the other. It is just a articulation of the existing and emerging science that we have around safety. And I would also note, as the governor did, that the CDC actually put out confirmatory research earlier this week saying, yes, indeed, having in-person instruction, especially for younger grades, is achievable. And then on the data side, where we have put into place a couple of reporting requirements that'll help us measure that. But I'll actually give the floor to Dr. Bardock for both, for both sets of questions, because she's best positioned to really explain.
Mm-hmm. Yeah, no problem. Yeah, so that evidence document is I think a helpful document for people to look at. As probably all of you know, COVID is rapidly changing. So there's actually a more recent study even than what got into that evidence document, and it's on my list. It's going to be a living document, that evidence document, because things keep on coming in. So I'll describe one thing that I do feel like is a very helpful study that came out recently, which was in North Carolina, where they had very high community rates of up to 29 per 100,000. They found that in a group of 11 different school districts, they put in a program that was 3 different pieces: masking, physical distancing, and hand washing. That was the sort of emphasis of their program. And they found that very little in-school transmission. So we know that the thing about COVID-19, there will be community cases that happen that might even come onto the school site. And the most important thing with all those mitigation strategies is that we want to block in-school transmission. And that paper actually demonstrates very nicely that even in a high prevalence time and community high prevalence rates, that if those mitigation strategies are in place, that there's very, very little in-school transmission. And the in-school transmission actually had to do with gaps in the protocols. So people eating together or not masking. And those are, things that they were able to change and then improve from there. And I actually talked to the author of the study, and he said their rates in North Carolina after that study got published have gone up to even as high as 90 per 100,000, and they're still seeing the same kind of things. That it's the mitigation strategies that are in place in the schools that are extraordinarily helpful for blocking that in-school transmission.
Thanks, Dr. Bardock. And I think that science is important in terms of us to continue to go back to. One more question from me. We get the question a lot. Obviously, a lot of the emphasis, because of the science, is on opening up schools for the youngest learners, TK through 6. We do get the question, and I think Jason asked, essentially, what about high school students? That the messaging piece out in the public is when we talk about reopening schools, they assume that that's also older students. I know that feeling. I have a new teenager, turned 13 today. She's in middle school. And so they hear that. It's like, oh, does that mean our schools are going to open? So obviously, given that the science is focusing on the younger students, what's kind of the plan to address the other grades? And I think the specific question is there potentially a pathway for some of these middle to high schools to also get some relief on this end? I'm assuming that Dr. Bardock, but Ben and Brooks know a lot as well. So jump in there as you see fit.
Maybe I'll start and then they can add. The evidence does show that elementary schools are different than high schools and middle schools. And that there's much easier, it's not much easier, but there is greater transmission in the high school setting. And so that's why the emphasis first is on the TK through 6, because we know that there's less likelihood of transmission. And I think that it's helpful to point out that in high schools, part of the reason, and probably middle schools too, part of the reason why there's increased rates of transmission are 2 things. One of which is that the high school and middle schools, their bodies are a little bit more likely to transmit it, and that has to do with sort of the basic science behind how SARS-CoV-2, the virus that causes COVID-19, passes between people. But there's also a structural issue, which is that high school and middle school curricula mean that kids are mixing in across groups a lot more, and that actually allows an opportunity for spread. So as we continue to move forward, to build confidence with TK through 6, and I extraordinarily committed to the idea of we got to get those middle schools and high schoolers also. But I think as educators think through this issue, I think the stable group piece is very important for people to understand that that's part of the science, that's the part of the reason why it's a slightly higher risk situation. And so as much as you can aim for a stable group, that will actually help make a safe high school and middle school environment.
And Edgar, I would just only want to piggyback on that answer briefly and think about my own 13-year-old. Seventh grader.
And my 13-year-old too.
The theme
Me
here.
too. Me too.
Yeah.
We have to get them all together. There's it is really to underscore the fact that the presumption that I hear behind the question, which I think is entirely appropriate given where we've been in recent weeks, is that we're talking about a pathway to reopening those grades while in purple. Because obviously we have the reopening process previously had the waiver process for the elementary grades. But I don't want to lose sight of the fact that under the current tier construct and under the guidance, those grades are eligible to open once you get into the red and other tiers outside of purple. And I think that's going to be really important as we think ahead to what the governor was highlighting, which is that thankfully, folks are doing the right things. They're masking, they're distancing, and we're starting to see that curve bending in a very significant way across the state. And therefore, hopefully we'll have more and more places where the ideas under red and other tiers, bringing back those upper grades is allowed and appropriate. But really, I understand the question coming because obviously we've all been in the purple, but I just don't want to lose sight of that in terms of where we're headed.
Yeah, the way I think about that is like, in a lot of ways, we're not holding back on middle and high school. We're just pushing forward on TK and 6. And I think just to kind of contextualize for ourselves, we were in a position a month ago in which, a lot of, we were hearing that a lot of, LEAs were contemplating, remaining in distance learning for the remainder of the school year altogether. And so what we wanted to do was make sure that we were making a big push in the areas in which we are confident that safe in-person instruction can occur. And then the overall theory is let's focus in on those grades where it's most needed and we have the best evidence that it could be done safely, and then build that trust and confidence and that experience with implementing those safety precautions, and then getting people more and more comfortable with expanding out from there. That's all just to say that we're not holding back. It's more that we're just pushing forward as much as we can on the early grades and then the vulnerable students who are disproportionately impacted by the pandemic.
All right. Thanks to all of you. Ben Cheetah, Chief Deputy Cabinet Secretary, Brooks Allen, the Executive Director of the State Board, and Naomi Bardak from the lead of the Safe Schools for All plan, and apparently going to become a part-time ACSA employee by the end of this pandemic. You'll be part-time with us. So thank you to all of you for joining us with our superintendents today. Thanks so much. All right, Edgar, that was good. Lots of interaction from our members in that one. And don't forget, folks, coming up at 4:10 today, the ACSA legislative lunch break. The two of us are going to go in depth with State Superintendent of Public Instruction Tony Thurman today, and we're going to get his Super Bowl pick, Edgar, at the end of this, and we're going to hold him to it.
All right. Happy hour edition. I like it. So I'm looking forward to that.
Yeah, Edgar, we'll see you at 4:10. Michael Kelly, my co-host, comes back in to the fold over here. Michael, a good amount of time there with the governor and with the governor's team. A lot of superintendents got some of their questions, and we're looking forward to the afternoon.
I felt left out that I was the only one who doesn't have a 13-year-old. I've just got a 3-year-old. It was an incredible session. We're grateful to the governor for taking some time, and Wes did an absolutely masterful job with that interview. So thanks to Wes. It certainly took some of the pressure off yours and my shoulders.
That's right. That's right.
All right, lunchtime here at the 2021 ACSA Superintendent Symposium. And so we're going to step away for a little bit, but not for long, because it's 12:35 and we're back at 1 o'clock. You will hear from our second keynote speaker, Pedro Noguera. We're back in a bit.